Okay, great. So I'm just going to go down the line. Adrina, I'm going to start with you. If you want to just take a moment to introduce yourself and talk a little bit about your involvement with CLC.
Yeah, hi, I'm Adriana. I use any pronouns. I joined CLC like in the middle of 2020, I suppose. And I think what we're doing and what they're doing is super important because mental health is more important than now than any other time in our history. And the fact that there are organizations like helping improve it and such is a really great thing.
Great, thank you. Ranjini, do you want to go next?
Yeah. Hi, I have been working with CLC for about a year and a half now, and I'm a senior at Legacy High School, and I'm also the president of the youth board.
Great. Lily, I know you're a newer member. You want to take a minute to just introduce yourself?
Yeah, hi, I'm Lily. I'm a junior at Connections Academy, and I joined the board because I just think it's a great opportunity to reach out to people who maybe didn't have a hand before to reach out to.
Great. And so our youth board is made up of, now we have 15 members of different youth ages 14 to 18. And they come from different background, race, ethnic, gender, and it's a very diverse group. And all of them are very passionate about wanting to make a change in behavioral health for other youth. And most of them are also coming from a place that they've had some of their own struggles with this, and that this work has made some difference to them in some capacity. And they want to pass that torch along. And so we couldn't do this work without their help, their perspective, and just very appreciative of all that the youth board puts into this. So again, I know there were several that wanted to be here today that aren't on, and some of them will be joining a little bit later as we go along. But that's kind of an idea of our youth board. And then we have an intern, Elise, who's with us this semester. Elise, would you like to take a moment to introduce yourself?
Sure. I am a psych major at MSU Denver, and I'm interning this semester. And it called out to me because I feel like when I was a teen, I needed stuff like this and I didn't get it. So that's why I decided to intern here. Yeah.
Great. So that's kind of our board. I'm going to do share my screen here again and show you one more thing about us. If you guys get on our website, you can go to our adolescent program, and you'll see really wonderful testimonies from various youth. Some are board members and some are just kids that went through the program and it was really meaningful for them. And then we have partnered with a nonprofit called Storyboard, and they are also helping us to do storyboards on some of our active members to help us tell our stories. So get on there and you can kind of poke around and see a little bit about what we do and what our curriculum is about and how and why it's helping to make a difference in teens and helping in education and helping teachers to teach the subject of this. That was one of the things that came up in the group. And the other thing is, thank you so much for hosting the group talks, getting the community together to talk about behavioral health issues, both with adolescents and adults, and having these community forums, because it is so essential for us to come together. There's so many layers to this. And that's how we began the change, right? The first step is awareness and coming together. So we thank you as an organization and all that you guys are doing to help to change this, and feel very honored that you're giving us a seat in helping to have a voice in that solution.
Absolutely. Well, thank you. Well, I wonder if it makes sense for us to take just a moment to introduce ourselves.
Yes.
So I'll start. My name is Emma, and I work at Tri-County Health Department. And the event that Robin was speaking of was really kind of something that resulted after several years of work that our agency and our partners have done. That really is meant to help us work better across partnerships and different sectors in our communities, so lots of different kinds of services and professionals and community members to help improve mental health and prevent suicide. And the reason that we had so many people there in part of this work is that, as you all know, they're very complex issues. And so complex issues usually need more coordinated solutions that aren't just like one thing. So we need lots of different expertise and lots of different voices at the table to help us do this work better. And so that's really what my job is all about, is to help us do that coordinated work across partners. And you see a 10-year-old here often on the screen. This is my daughter Harmony, and we're on spring break right now. So she was excited that I was going to meet with some kids today. She thought that was pretty cool, because usually my meetings are boring for her.
They are.
So anyway, so she gets to go. But that's kind of who I am. And then I'll hand it off to Mara, and then we'll introduce Gabriella as well.
Yeah, hi everyone. Sorry, I'm in a dark room and I like tried to turn a light on and I feel like it made it more like a horror film kind of spotlight on me. So sorry about that. So I'm Mara Proser, and I work with Emma on some of our behavioral health work. I do the work that I supervise really is a little bit more focused on the substance use end of things as part of the behavioral health, but Emma is always happy to collaborate. So that is, I have the privilege of collaborating with Emma on a lot of this work. Gabriella is going to introduce herself. She's with our data team. And then I do a lot of, I'm in the community health promotion division with Emma, and I provide a lot of data communication and data interpretation support for our division. So I think that's the role that I'm helping to serve here as well.
Wonderful. Well, and you got our list of questions, right? Good.
And they're awesome. I'm so glad to be having this conversation, because I have a lot of the same questions you had, actually. So it's really great to know what people are wondering. It helps us better display and communicate our data.
Great.
You all picked up on a lot of the issues that we wrestle with a lot. I do want to let Gabriella introduce herself too, if that's okay.
Oh, sorry, I didn't
okay.
get to see. And actually, I missed one of our people that are on there too.
Okay.
I have so many people on, I don't see everybody on.
I know the screens are tough. It'd be great to do in person, wouldn't it?
Yeah, no worries. So I'm Gabriella. I'm an epidemiologist and data scientist with Tri-County Health Department. So I help support more on Emma by pulling data for them and help with analytics as well. So I'm sure that that's the role that I'm playing here as well.
Great, nice to meet you. Hey, I see that Bren is on. Bren, would you like to take a moment to introduce yourself?
Hi, I'm Bryn. I've been on the board since near the end of 2020, and I joined the board because I've been through a lot and I know what it's like to grow up in a rough household. So I want this to be exposed to more people, because I know it personally really helped me a lot.
Great, thanks, Bren, for joining us, and thanks for being a part of our team to make this change for others. And I don't know, there's one more iPhone. Is if you're on and you want to introduce yourself, you can. And if you choose not to, that's okay too. All right, good. No worries. You can be in background. And why don't we get started, guys, with those list of questions? Is that Okay, let's move on to doing that. Share screen. Let's get to the list of questions. Actually, before we get to the list of questions, I wanted to just take a look at some of this stuff I kind of pulled out from your thing. Are you seeing my screen now with the suicide morality charts and all that? Do you guys, mortality, are you seeing that on your screen?
Yeah, we are.
Okay, good. So just, pointing out a few of the things of, there was the Adams County and how we are continuing to go up and looking in our northern corridor at such a hot spot, right? And where we are with some of our numbers, very high in the Asian community, which we're still trying to get some of those questions of, why this is happening. And we can refer back to this chart, but these were the overall with the races of where we are and what the statistics look like. If you're considering, do you have a plan, or were you actually attempting? And then these down here, there weren't as many in the gender identified pieces, and we were missing some of the data from that. Am I correct in that? Not, they didn't have as many of the chart of the data as you did with the other.
Gabriella, do you want to maybe do a quick overview of the Healthy Kids Colorado and what data we're looking at?
Yes.
Thank you.
Yeah, that might be better. I'm going to stop my share. Do you guys want to do a share on your end?
We can. Gabriella, I have the full slide deck up that I can show if that would be useful.
Yeah. That
Yeah.
would be
Okay,
helpful.
let me pull that up.
Okay, hang on. Let me stop my
Oh,
share.
let's see, Robin, I'm not able to share.
Yeah, hang on. Let me give you more share rights here. There you go.
Oops, slideshow, there we go. And we'll go through some of these. Let's see what we want to look at. So let's start here.
Yes, that's much clearer.
Yeah, so this is the Healthy Kids Colorado survey data. Are you guys familiar with that survey? No? Okay.
No one was. And so they were like, what is this survey? And, where does it come from? And how do kids actually, and because we know nothing about it. So
Yes.
that was one of the questions is, how are you getting this data? Like,
so Adams, Arapahoe, and oh yeah, we pulled off Douglas data. But Adams and Arapahoe, they participate in our Healthy Kids Colorado survey. So it's put on by CDPHE, the state health department. And it's a survey that's completed by high school students. And so there are certain participating schools that contribute to it. And the 2019 survey, so that's the most recent survey data that we have. And so you have different indicators. These are their different mental health indicators. There's a whole slew of questions on there, including like sexual health questions. So on here, you have on the very left, the percent of students who felt sad or hopeless and stopped doing usual activities in the past year. So all these questions are based on their behaviors in the past year. The percent of students who considered attempting suicide, percent of students who made a plan about how they would attempt, and students who did attempt. And with this data, like these specific indicators, you see pretty similar percentages across the board, across all of our counties in Colorado. So these aren't particularly different for our counties compared to other counties.
great. Thank you for the clarification on that.
Yeah,
So,
and maybe just a couple of things to chime in on. So this is what students tell us in the survey, right? So it's how they answer the questions, which we think are pretty, pretty honest, but maybe, there may be some, differences in how people respond to the survey. And like like Gabriella said, there's there's a lot of questions that are answered. So we just pulled a few of those that we thought were most relevant to the mental health topic for our summit, but there's lots of other data to look at, and so we can share that. And I think probably maybe just one last little piece is that not every school in Adams County or Arapahoe County participates in Healthy Kids Colorado. And so Mara might speak a little bit more about that because it gets tricky.
If I've looked distracted, it's because I'm trying to cut and paste. I have a document that has just some, key points about the survey, what it is, and some of that. And I'm trying to copy it from a Word document and paste it into the chat for you. And it is not appearing to let me do that. So I will just tell you. So the Healthy Kids Colorado survey is, as has already been said, it's a survey that's done in schools, and it's a random sample. So not every school participates. It is schools that are selected to participate, and they do that in order to get a certain number. Gabriella can explain much better the randomization and selection process. And it's also what's called a multi-layer random sample. So it's a random sample of classrooms within a random sample of schools. So not every student participates, not every school participates. And then they use a statistical method called weighting to make estimates that, so let's say we heard from 500 students, we can use statistical methods to make an estimate of what that number would be in the full population. So those are some key things to keep in mind. So that they are estimates. We can never say for certain it absolutely 100% is 7% of students. And then also these are done in public schools. So there's a couple things to think about there, and it's done in the classroom during a school period. So a couple things to think about there is this is only representative of public school students. So I actually don't know the answer if there is a major difference between students who attend public schools and students who attend certain private schools. That's something that we have to consider. Maybe, is this truly representative? The other thing to think about is, are there students who are more or less likely to be in class? And so in my mind, when I look at, because they do weighting, right, if there's not enough students responding to a certain question or enough students within a certain group, you won't get an estimate. So that's why, for example, there's a couple graphs where you'll see blanks, right? Like there were not enough students identifying as Black, for example, who answered that question. So we don't have an estimate. So the question is, okay, there weren't enough students. Is it because not enough students were there? Were we not reaching the right students? I truly don't know the answer, but these are things that we have to think about, especially when we talk about surveys. These surveys are done in school. Who is more or less likely to be missing school? We know that students with certain chronic diseases, students with asthma are more likely to miss school. Students who are with unstable housing or experiencing homelessness are more likely to miss school. So those are just, I'm not saying that these definitely mean those students weren't included, but we just have to keep some of these things in mind as we're looking at these points. Those are the key things I like to make sure people know. If you're in 2019, 53,520 students across the state participated, and that was from 195 randomly selected middle schools and high schools. So it's a big sample. There is a lot of statistical confidence in these estimates. But again, we just have to think about, this is a survey of public school students who were in school that day. And also the self-report, as Emma mentioned, we feel very confident that the self-report is reliable, because if not, we wouldn't, right? Everyone says, oh, kids are just going to color in random things and they're not going to be honest. But the fact that we have very stable trends from year to year, that indicates to us that students are being honest, because if they weren't being honest, one year we'd have 85% reporting that they did marijuana, and then the next year it'd be 5%. And so the fact that we have very stable estimates is one of the reasons that we feel very confident in the estimates that we have. But then we also, again, have to remember that it's self-report. So race is self-report. It is how a student identifies. So that really comes down to that comes down to the individual, as far as if we're talking about how many who identified as Black or African American, how many who identified as Asian and Hispanic or Latinx, right? That it is a self-identity. Same thing with sexual orientation and gender identity. All of those are self-reported. So that's just to make that clarification. That is no one else making the determination on anyone's behalf.
It's probably also fair to say that this is based on which boxes you can check. So if the boxes aren't there as to what fits you, you know, that's going to limit the sample. And so in looking at this this here, so we often get the question of, well, where are all the other letters when we talk about LGBTQ plus IA? You know, that there's lots of ways that people may identify. And in this particular survey, these were the only categories that people had option to click or to check. And so that's definitely a question that comes up often in terms of how the data then gets represented. It has to come through that filter of how the survey was written.
Yeah, and I know one of y'all's questions, the first question I think had to do with students identifying as Asian, and which Asian groups is that? So that truly is any student who self-identified as Asian. So I cannot tell you that includes every every Asian subpopulation. It's truly how students self-identified. I think there's a bigger question of why are these the categories that we use, which is a much larger societal question, if I can be perfectly honest, with how race was ever determined to be on the census, how many decades ago. So, I think we will acknowledge these are the most reliable data that we have, but there are a lot of limitations to them, especially if we want to look at them and really help us try to understand what's happening among students identifying as LGBTQ or students who identify as Asian, things like that. There's still a lot of limitations there.
I see a hand up from Adrina.
Oh yeah. So when you said like there wasn't an option for like every Asian subcategory, did you mean like by country?
Yeah, and so I'll also be honest with you. If I'm old, if I say the wrong thing, I do want someone to tell me. So yeah, I think
changing all the time, right?
And I do want someone to tell me if I'm using old terminology. So my understanding is that, because I am not of Asian descent, my understanding is that if you are of Korean descent, that is a very different culture than if you are of Chinese descent or if you are of Indian descent. There are differences among the Asian population, and we lump them all together. So there is no way here to break down, is this something that's occurring among all of our students identifying as Asian American, or is this only occurring in the Vietnamese community? We will have no way of knowing that from these data. And I have not tracked, I think Census recently started breaking down. Gabriella would know that better. I think Census now gets a little more granular, but on these surveys, there's just not enough ability to do that.
The most recent census expanded on their ethnicity categories to include a lot more sub-ethnicities.
Okay.
Why are you not able to expand that? Because I guess our group said, and when we got together and we talked about this, particularly because in Asian numbers here, we are alarmingly high. And so you got to know more about why is that number high, and part of the thing is understanding what you're dealing with. And so is there a way, particularly with that population and the LGBT population, as those are our highest populations, to really look at that differently? Because I know that some of the boards that are identifying in the LGBTQ community had said, like that's an essential piece in identifying for that. Oh, Bryn just got off. That this might be a person that has something to say about that. Are you back on, Bryn?
Yeah, I am.
We were just talking about, like on the survey about how you guys were talking about the importance of being able to identify if you're really going to understand the population, like in, for instance, LGBTQ population, that you should have more self-identifying options. And did you want, I know that you speak on behalf of LGBT community a lot. And so I wanted to know, do you have any thoughts on that?
Yeah, I do. I actually think that I agree with you. I do think that we should expand on it more, especially with like within the LGBT community. I've noticed certain groups experiencing certain things a lot more than other groups within the community. And so like as someone who is both queer and trans, I don't think that, especially on that scale, that we should be lumping like all of the queer people and all of the trans people under one umbrella.
Okay. And so you were saying that there wasn't a way to do that. Can we look at changing those things? And then also with the Asian community, and I know Ranjani, you had some really good insight on that when we were talking about it. Did you want to share as being lumped in an Asian? Both you and Adrina had some really great things to say. Would you like to add to any of that?
Yeah, I guess if we're talking about Indians in specific, I think a big problem that I've specifically noticed is that our parents tend to be immigrants, and they have experienced a school system that's like different. So when they come here and then kind of expect us to go in that direction too, and kind of push us in that direction, and we don't have like this support structure around us that we would have had in India. But this is like really specific to just Indians, which is why I would also like more clarification as to what Asian really constitutes of. But just to Indians specifically, since we don't have that kind of support structure, I feel like a lot of us are kind of feel confused and in a different place, and our parents' ideologies don't really coincide with what we learn at school. That's just, but then again, this is just very specific to Indians, which is why it's very important, I think, to have that distinction.
Yeah, I love that feedback. And I think everybody from Tri-County is nodding, and probably inside nodding even bigger, because we completely agree with that. And I think in the work that we do with our community partners, that's where we start to understand some of these differences better. And it's super helpful to hear that. But I think one of the challenges, and going back to Robin's question, is when we do these massive surveys, and when I say we, I mean the state of Colorado. And so this is a survey system that is done across the state. It's run by the Colorado Department of Public Health and Environment, like Gabriella was saying. And so to have differences or changes added to them requires some advocacy, frankly. So, when we advocate, it means that we, go to the big systems and say this needs to change. And I think that would be a very powerful point to make, coming from you versus me or Mara or Gabriella in some ways, because I think that often our systems are most responsive to people in the community like you, to people who are living the lives that you are living, and finding challenges with these systems.
Right, definitely. I have a question about that, not exactly relating to race, but I recently did a survey at school from Johns Hopkins University. So we do have like a lot of private institutions coming to our school and doing surveys, and they did distinguish between different types of Asians. So I was wondering, maybe is that, just putting that out there, is that an option to get that data from universities who do surveys?
She's in Adams County, Adams 12, by the way.
Yeah, that's great to
To
hear.
know about. We would love to see that survey, see how they broke it down. But yeah, if we are working on better sharing of data. What was what do you know what it was about, or did they
It
say
kinda
like this is
was-
part of program?
Oh, I'm not really sure what it was. They just told us that it was from Johns Hopkins, and it was about a wide variety of topics. They had drug use and also sexual health and questions about mental health too.
Interesting. And that's at Stargate Charter School.
It's at Legacy.
Legacy.
Up
Oh,
now.
I'm sorry. Oh, you're at Legacy. I don't know why I always think you're at Stargate. I get that mixed up. So yeah, no, that's actually one just straight up public. So, okay.
And it's helpful for us for me, I'm fascinated to hear that they did that and that they broke it down. And as Emma said, we don't control this survey, but we can advocate and the public can advocate for changes. And I agree with Emma that it's, it's more impactful when it comes from those truly experiencing having these questions. I forgot what else I was gonna make a point specific to that piece, but I think the being able to really say why, and then because if we see this number, we don't know, right? We see that I forgot what the indicator was super high among students identifying as Asian, but we don't know what that means because all of our Asian communities are not one, and so I can say we really want to understand. There are other ways to answer the other question. I would then suggest, well, that's when we go to the community and we do maybe a little more qualitative research into, working directly with the community and talking and listening to communities to understand, is this happening everywhere or is this truly within one or another? But, you've expressed better than, Emma or I could. As white women, we cannot express the differences between Asian communities and the difference that you're feeling in each culture. So I think that it's great that you're asking these questions, and we're already trying to think of how can we get you in front of people who have authority to make some changes.
So that is a question. Would you guys like to possibly go with us in a group of us and give a presentation to the Behavioral Health Task Force committee? I think that might be a good place to start. What do you think about that? Emma, is that possible for some of your team members to come with us jointly and some of these students to go and bring these very issues we're just talking about?
Well, I want to hear from Adrina, and then maybe we can talk logistics, because I know
Okay.
They came off mute.
Yeah, I was about to just ask. I noticed on the survey, sorry, there's like a bunch of students walking past. They grouped gay and lesbian together for one. That was also one that I know it's like Adams 12 didn't have a bar, but I don't. Anyway, the experiences between masculine people and like feminine people are very different, and even though they share that one trait of being attracted to the same sex, I'm like, it could be all lesbians and like 2 gays and we wouldn't know. So I know you like can't really do anything to unlike you could just say you can advocate for changes, but you can't go on like a Google Doc and just like click delete. But I think that I just wanted to say that. Another thing is about the Asian population. I myself wasn't thinking specifically for like, do you identify as Chinese or Vietnamese? I was just thinking like, South Asian, East Asian, because if you just like, there's a lot of cultural differences and such like that. But there's also the fact that if I'm being blunt, East Asians look different from South Asians, and that can affect how racism affects them. Furthermore, I didn't see it on the chart for race. Maybe I just missed it, but there wasn't really an option for biracial, which I think could be very important, because I have a friend who's like Black and like and Korean and like a bunch of other stuff. And like if he took one of these, I don't know what he'd put, but it's like very conflicting because I myself am biracial, and like I wouldn't know whether or not to put like, oh, should I put Asian? Should I put white? You know.
That's a great question. And in the Healthy Kids, for example, there was a mixed race option, and that was you know, an option to put in. But yeah, how you identify as mixed can vary drastically, and so yeah, we have a lot of refinement to do in these pieces.
Yeah, that was gonna be my question to Gabriella is it mixed race, or is it check all that apply, that we actually could stratify by those who identify at least, yeah, Asian as at least one, or things like that? I don't know if it's how we analyze it and display it, or how the question's asked. Because I think some of what we're hearing from you is this is good feedback on how we display it, because we could break it down. We could, among LGBT, or, you know, at least lesbian and gay, we could then break that down by gender identity, I would think too. So some of it could be how that's not something that we had thought about different.
Yeah. But I also noticed on the queer that the options were bisexual, gay or lesbian. Let's see, what was the other? Heterosexual, and then unsure. I noticed this a lot, but there's like never an option for other, which seems like kind of like a basic one, but like, okay, I'm not any of these. Say I was asexual. I'm not any of these, but I'm also pretty sure I'm asexual. Do I just skip this question? Or like, so for that one, it'd be great if there was an option for like just queer or other. And that, even though that's like other, would still be very not like refined. It's still, I think it still help a lot.
Great. Adrina, thank you so much for all that feedback. And I guess that goes, because I'm looking at our time here, and we had set this for 45 minutes. And I know there were a couple more things we wanted to try to address within this meeting, but I think it's clear that this should be a continuing process, and hopefully more conversations. And I would love to get your feedback on ideas of who you guys think would be good steps for us to get in front of, to have these kids' voices be heard.
So I have lots of ideas, and I think I love the idea of us coming back and digging a little bit more into the data, because I know you had a lot of questions that we didn't even touch today. And then I think the who, like the which audience can we think about in terms of advocating for change, is a really good one. And so I think if we're really interested in changing Healthy Kids Colorado, I think we need to be talking with the people who design and make the survey and distribute it. And so we can absolutely help with scheduling and getting the right people there for that, and going through a process. I think that would be excellent. But Robin, you also mentioned a group that's been involved in making recommendations and designing processes that will go into mental health system change at the state level as well. And there's lawmakers that are meeting right now to review bills and turn them into law. And so there might be some opportunities if people are interested in talking to policymakers. And I think that could definitely be a really great option too. So I'd love to explore those a little bit more.
Great. Yeah. Well, I know that these guys, they're busy, but if we can, schedule it in enough time, there were quite a few board members that want to be here today that couldn't, and all of these kids are activists for making the change. in this community and beyond. But before we go, I know that there were a couple of things that were talked about in the dyad groups. And there were like 3 different issues of solutions of what here. I'm going to just share my screen real quick here. And we don't have a whole lot of time to go through some of this, but some of the notes that I took the other day when of things that I took back from that meeting in different dyad groups of solutions that people were coming up with. I took it to our youth board and got some feedback. One was there needs to be more storyboards from adults to inspire kids. I'm not going to say it's a hard no, but a lot of the kids felt like that this was kind of one of the problems is that they don't feel connecting to adults these days, and that it wasn't necessarily, they thought, most inspiring and most helpful for a solution to hear adults' stories. A lot of the solutions that they're coming up with today, you see a lot of campaigns for just know that you're not alone. And although that can be helpful, for some kids, that's traumatizing. That's not helpful for them. In fact, that makes them feel worse, that people feel like them, because they don't want anyone to feel as bad as they're feeling. And it makes them feel bad that anyone is in as much pain as they are in. So how can we come up with campaigns that are helping kids to not only feel that they're alone, but what are the solid solutions of what's working for them, and sharing those stories, not just the what's not working, but what is working stories with youth, and looking more for those kinds of storyboards and connections. So that was feedback on that. And then there was some real passion about that there needs to be more support, and that this shouldn't be in the schools. And although we feel that there absolutely should be more support in outside of schools, and don't get me started on that, we have a lack of that in the Northern Corridor in particular for a lot of different reasons. And we have a whole list here, and we can send this over to you. But between the barriers of access and not enough counselors and not enough connecting counselors and or support, like if you get into support and it doesn't seem to be a good fit for you, there aren't a lot of options to then go find other support. So limited support and access and affordability and all those things that are creating the barrier of access. And then not to mention that there's not really no real solutions for places for inpatient care in Northern Corridor and or good therapists. Parents are having to drive upwards of 45 minutes to an hour sometimes to get to therapy appointments, and that's not realistic. So, and then 8 to 10 weeks out when you're trying to get appointments, when you can't even get appointments, you can't even get in until 8 to 10 weeks out. Or if you're calling crisis center, you're waiting for a very long time before you even get to talk to a person. Like all of these things that are really make it hard for these kids. And absolutely, there should be more support outside of school. We would like to see and are advocating for the Butterfly Pavilion, when they vacate that building, to be turned into a nature center, adolescent inpatient, outpatient care for families, for adolescents and their families to get care. Right now, the Westminster City is looking at turning it into another performing arts center, which we don't need in the Northern Corridor, quite frankly. We need more behavioral health centers. But anyway, that we are having conversations around that, and would love to see a community centered like place like that in the Northern Corridor, of something like that coming together. Then there's one more, and I know we're out over time here, you guys, so I appreciate your patience. It was with youth connecting better with race, gender identity. So there were some people on there that said, well, youth need to be in like-minded groups, and a kid's not going to connect to a teacher that's white if they're Black. And my students didn't exactly feel like that was necessarily the best solution. In fact, they thought that was a little bit of a racist statement in itself to think that you couldn't connect with someone because they didn't look like you or were the same race or whatnot. Now, it might be helpful outside of classroom spaces to have more groups and clubs or supports. But first and foremost, we also need to be looking at the classroom space. We've got to be looking at, we teach health, how to eat healthy. We teach, the basics of drugs. Drugs are bad, don't do them, but very little of the SEL support that's happening in our schools today are on the deep level of really getting to the core of behavior health and the science behind it and what to do about it. Why am I feeling the way that I'm feeling? It's a human condition, and what do I do about it? What are helpful coping mechanisms to be able to get out of that? So those were the kinds of things that we wanted to come to the table with to bring solutions. And if any of you students want to add anything, you can, but I do want to say we're over our time.
I could say that I can stay on until my door opens. We have some people coming here at 5 o'clock for therapy, actually. So but I can stay on for a few more minutes. I think it's most valuable to hear from you all. I really appreciate these reflections from the conversations that Robin participated in, and we need to have more of these kinds of conversations, and we will be. So I think we've generated a few ideas of places where advocacy can happen. But I think it's really important for us just to keep talking, keep hearing your questions, and keep doing some of this brainstorming around what solutions or ways of addressing this are needed, and then how to go about getting that in front of people who can actually make some change, whether it's by resource allocation or policy making or just the ways that we talk about these issues. So Ranjani, I see you came off mute. And then I also saw Bryn's hand up quite a long time ago. So I don't know if she still wants that to be up.
Great, thank you. I'm not seeing everybody's picture at the same time. I'm terrible at hosting this many at the same time. Thanks.
Yeah, I wanted to add something to kind of the proposition of the propositions we had, was that I was thinking, it looks like the health survey, the kids' health survey was actually kind of problematic in the way that it collected data. And, I would say that a solution is more of seeing what we can collect from our schools right now, like feasibly, instead of trying to change the survey, which I believe it looks like a really difficult process. And I was kind of getting to that. One was like the private surveys that I've been taking. I don't know. I mean, that data looks like it'll be really helpful to you guys. So if you can somehow get that, or every time I go to the counselor's office, they make me turn in this Google Doc sheet of the reason why I'm there and my student ID, and I have like a ton of information on that. So if you guys, if that's common to what other schools do around here too, then I would say that data is also pretty good.
And Jenny, did you say that you're in Adams 12? Is that where your school is?
Yeah.
Mm-hmm. Yeah, some of these things we can certainly dig a little deeper into with the school districts. And we have some good relationships there, especially in Adams 12.
Is it okay if I said something?
Yes.
Okay. How much power do you have over like what charter schools within this district can and cannot do? Because I'm noticing at the public schools, there's a whole bunch of stuff going on, like surveys and like what Ranjani was talking about with like going to counselor's office. I've been at Prospect Ridge Academy, which is a Adams 12 charter school, for 4 years, and I've never seen any of that ever. And I know tons of people who've like been to mental hospitals. So it's not like it's like, the more elite your school is or something, like the less problems there are, because there's a lot. And I just like, I noticed that PRA seems to like go off on its own a lot regarding like mask mandates and stuff like that. So I was just like, how much could you do about that?
I love your question, and I love the way that you're framing it. So this idea of power and who can influence what is really, really important. And we don't have time to dig into that question today because it's a fairly complex one, but I'd love for us to come back to that. And I really appreciate your thinking around that. And I will just say that it may not come up in Healthy Kids Colorado, but we do have data from other sources that absolutely show that especially when it comes to adolescents, that socioeconomic status does not drive necessarily the mental health experience, that we have challenges and issues across all of those different experiences, and in some cases they're exacerbated or worsened, you know, in higher income and sort of higher expectation communities, if that's a way to kind of put that. So I want to put a pin in your question and see if we can come back to that.
Great. Thank you guys so much for your time today. And I would, Adrena, like to also say, you can be part of making that change. That's why you guys are involved in this and doing what you're doing, is because you do get to have a say in this, and you can be an advocate for changing this. And with your help, we can change this. So let's do it, Adrena. Let's change that in your school. And you have us at CLC, the adults that are involved, but you know, reaching out, we're going to try to reach out to more in the community, like Tri-County Health, and partnering so that we can come together to support, so that you have a voice to make the change.
I keep seeing, sorry, I don't mean to interrupt. I keep seeing Bryn popping up, and I'm just wondering if we have like no time, but if she wanted to say something.
Oh, Bryn, I keep forgetting please speak.
Hi, I just had something to add about like data collection and like if we wanted more data points. I attend Horizon High School in Adams 12, and I am also on the Sources of Strength board there, which is the suicide prevention board we have at Horizon. Not many kids know about it right now, but like we're like building up our reputation to try and get more stuff out there that's like less sugarcoaty, I guess, less of the, like, we phrase it as toxic positivity with the you matter, you're not alone, please talk to somebody, like all this stuff that we hear a million times over and over again that we found makes most of us feel worse within our own school, and we want to see if that trend is elsewhere. And so I feel like finding data on that might be helpful.
Thank you, Bryn. Very well said. Okay, so my dog's barking like crazy. I think people are here, but I just want to say thank you all. This has been super exciting to me, and you know, I think we have lots of next steps to follow up on. So I'll get back on mute because it's really noisy here. But you guys rock, and I really just echo Robin's you know, comment that you are the change, and we're just really happy to be able to help support you in that, and you know, in your advocacy.
Great, thank
We
you.
can continue these conversations or support that advocacy. I'm passionate about this stuff, and I could talk about this forever. And I wish I thought about these things when I was your age. So I love that you guys are thinking about it, and we need you guys to help us make change. So thank you for starting this, and I hope we get to, I hope I get to be a part of these continuing conversations.
Great. Well, we'll be in touch with you guys with some ideas for strategy, who to reach out to, and how to partner to make this change. Did any other students want to have anything else to say before we go? And if you do, just start speaking. I mean, unmute yourself here. Does everyone feel good for now? All right, great. Hey, have a great rest of your day. Thank you for your time. We look forward to being in touch with your staff and your team.